Hi, I'm Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington. And today we're going to talk about tinnitus. When you hear that word, you often associate whiplash with it. So some type of pain that occurred to the neck, headache, or even stiffness in the neck. We don't usually associate the ringing in the ears or tinnitus. Sometimes it's called tinnitus as well. But in the absence of whiplash injury, this is you experience the occasional ringing sound or some type of sound in the ears, and some of those things can be, as simple as the cadence of your breath or even hearing your own heartbeat. This symptom actually occurs in men over the age of 40 most commonly, and the sounds like buzzing, ringing, roaring, hissing, or high-pitched sounds that can last for seconds to minutes. But I want you to imagine this for a minute or for a bit, that what if it lasted for hours or days? But before we talk about that, let's talk about the two types of tinnitus, and that's first pulsatile and the other one's non-pulsatile. The pulsatile one is related to blood flow problems that are occurring in the face and the neck area, so from muscle movements in the ear or even the ear canal. The non-pulsatile is related to nerve problems in one or both the ears. Some of the another thing is presbycusis is a lot of times when, and that's age related, when a individual works around heavy equipment or age types of things that would damage the hearing over time. Other type of causes can, and there's a whole long list that can relate to tinnitus or tinnitus: wax buildup, medications, alcohol, caffeine, rupture of the eardrum, dental problems, TMJ problems, elevation, so environmental, where you're in an airplane, elevator, or scuba diving, severe weight loss or malnutrition, as well as even riding on a bike with your neck extended for a long period of time can cause problems with that, as well as other nerve-related conditions such as Meniere's or MS or migraines. The good news is that most of the time tinnitus comes and goes and does not require treatment. If it is, it seems to get worse, then this is the time to consult your doctor of chiropractic. Spinal manipulation is very helpful in resolving tinnitus, especially when they're in lieu of and not using medications, which can cause secondary effects. So chiropractic is very highly effective, especially when tinnitus is accompanied by dizziness or vertigo. So because of the many nerves that innervate the neck and the head that arise from the cranial nerves that are at the base of the head, spinal manipulation of the neck as well as certain cranial manipulations can have a huge and dramatic effect on the treatment of whiplash. If you are suffering with tinnitus, vertigo, any of those associated conditions, even Meniere's, give our office a call, 360-951-4504, or go to my website at drdavidwarwick.com. Thank you for watching, and I hope this helped.